The air in Grandview Memorial practically hummed with an electric, almost palpable tension. President Thabo Ndlovu was here for a routine check, yet the gleaming corridors pulsed with a high-stakes energy that burst past rookie nurse Yara Solís. Her humble scrubs seemed to absorb the opulent light, making her feel like a ghost amidst the bustling symphony of elite medicine. A hurried senior nurse, her eyes dismissive, waved Yara away from the president's wing, muttering about rookies getting in the way, a familiar sting that Yara quickly tucked away. But even as she retreated, her quiet gaze, honed by years of intuitive observation where technology was absent, absorbed details no one else seemed to notice. She held a different kind of knowledge, ancient and visceral, though here, it was utterly overlooked. Then, from behind the closed doors of the president's suite, a chilling, guttural alarm sliced through the controlled comm. It wasn't just a beep, it was a desperate shriek of machinery, a raw cry of a system in sudden, catastrophic failure. The door burst open, and panic, raw and immediate, spilled out, washing over Grandview like an icy, terrifying wave. The piercing shriek of the alarm tore through the polished corridors of Grandview Memorial, transforming its hushed efficiency into raw, disbelieving chaos. The president's suite door, which moments ago had symbolized serene authority, now hung open, a gaping maw spewing forth frantic shouts and the rhythmic thump-thump-thump of a failing heart monitor. Yara, still reeling from the senior nurse's dismissal, was swept up in the surging tide of white coats, a mere speck in the sudden, desperate torrent. President Ndlovu lay on the gurney, his complexion now a terrifying ashen gray, his eyes wide and unfocused. The routine procedure had gone catastrophically wrong. Cardiac tamponade. The words hissed through the panicked air, a death knell. His heart, compressed by fluid, was being strangled, minute by agonizing minute. Then, Dr. Anatoly Kholodov burst into the room, a whirlwind of furious energy and intimidating presence. Out! Everyone not essential, out, he bellowed, his voice accustomed to instant obedience. The room, already a maelstrom, momentarily stiffened. Kholodov, renowned for his ice-cold precision and unshakable confidence, took command with the imperious air of a general reclaiming a lost battle. His eyes, the color of a winter sky, scanned the chaotic scene, locking onto the chief resident. "Get the pericardiocentesis tray. Now! We drain this fluid." His words were sharp, decisive, a stark contrast to the rising terror in the room. He moved with practiced ease, gloved hands already reaching for the sterile instruments as they were slammed onto the trolley. The chief resident, trembling, initiated the procedure, guided by Kholodov's curt, rapid-fire instructions. Yara, pushed to the periphery by the surge of essential personnel, found herself pressed against a wall near a bank of monitors. Her initial fear gave way to an intense, almost involuntary focus. Kholodov exuded an aura of unassailable competence, his every movement a testament to years of triumph. He was the man who never failed, the titan of cardiothoracic surgery. Yet, as the seconds stretched into an eternity, a hairline crack began to appear in his formidable facade. The needle was in, but the fluid wasn't flowing as it should. A trickle, then nothing. More pressure. Adjust the angle. Kholodov's voice, though still authoritative, held a flicker of something new, a sharp edge of frustration. The monitors, which had briefly seemed to stabilize, plunged again. The thump-thump-thump grew weaker, more erratic. Yara's gaze was glued to President Ndlovu, then to the various readouts. The chief resident, sweat beading on his forehead, adjusted the catheter, trying to find purchase. But it was like probing against the wall. The expected gush of life-saving fluid remained elusive. "What is happening?" Kholodov snarled, his eyes narrowing. His confidence was starting to curdle into barely contained fury. "There's an obstruction. It shouldn't be this difficult." From her vantage point, Yara saw it. Not on the scans, Kholodov had already dismissed them, muttering about their inadequacy. But in the subtle, almost imperceptible way the president's chest wall reacted. A minute, specific area, just beneath the sternum, seemed to bulge with an unusual rigidity, a resistance that was too precise, too localized for general fluid buildup. It was a visual cue, a slight distortion of the natural mechanics that her hands, trained to feel the body's whispers, would have immediately identified as a hardened, unmoving block. Her mind, honed in a clinic where a doctor's touch was the only diagnostic tool, instantly registered it as an anomaly, a blind spot that the high-tech, broad-spectrum scans missed entirely. A clot, yes, but not just any clot, one that clung stubbornly, uniquely, in a way that defied conventional drainage attempts. The seconds were now bleeding away, taking President Ndlovu with them. Kholodov's face was taut, his jaw clenched, his commands growing more frantic, less precise. He was trying every standard maneuver, pushing harder, adjusting, but each attempt was met with the same grim failure. The proud surgeon, used to bending reality to his will, was slamming against an invisible, impenetrable barrier. His control was rapidly diminishing, replaced by a raw, desperate fight against an unseen enemy. The thump-thump-thump was now a barely audible whisper, a dying plea. The clock was ticking, louder than any alarm, a relentless march towards an inevitable end. And Yara, an unnoticed shadow, felt the undeniable, terrifying certainty of her observation solidify within her. The monitors, once broadcasting a grim but steady rhythm, now screamed a frantic, piercing symphony of distress. President Ndlovu's heart rate plummeted, a jagged, precipitous drop that stole the air from every lung in the room. The thump-thump-thump was gone, replaced by a sporadic, stuttering flutter, a last, desperate gasp from an organ losing its fight. A thin, reedy wail from the ventilator indicated dangerously low oxygen saturation. The president's skin, already ashen, now took on a bluish tinge around his lips, a horrifying flag of impending hypoxia. Time wasn't just ticking, it was gone, vanished into the sudden, suffocating silence that fell over the operating theater, punctuated only by the relentless electronic alarms. Dr. Kholodov, once the picture of unflappable arrogance, was now a man unraveling at the seams. His movements, usually precise and confident, were jerky, almost violent, as he jabbed at the instrument's controls, his breath coming in ragged gasps. More pressure. More. There has to be a pathway, he roared, his voice cracking with a raw, desperate edge that stripped away every layer of his usual imperiousness. Sweat beaded on his brow, dripping into his sterile mask, and his eyes, usually cold and sharp, darted wildly, reflecting a terrifying, dawning helplessness. He barked orders at nurses, blaming the equipment, the lighting, the very air in the room, anything but his own inability to solve the impossible. He was a lion, cornered and roaring, but his fangs were blunted, his strength failing. Dr. Kyriakos, the chief of medicine, stood a few feet back, his academic brilliance rendered useless by the visceral, terrifying reality unfolding before him. His face, usually a mask of calm intellect, was pale and drawn, his jaw slack. He tried to interject, his voice wavering, "Anatoly, his vitals are, we're losing him. Perhaps we should consider," but Kholodov cut him off with a furious glare. "Consider what, Eris? Retreat? Failure? Not an option." Kyriakos retreated, his own certainty crumbling, the rigid protocols of Grandview Memorial proving utterly inadequate in the face of this unprecedented disaster. The air was thick with the scent of antiseptic, adrenaline, and the metallic tang of fear. The room, once a temple of medical triumph, now felt like a tomb. Amidst the spiraling chaos, Yara Solís stood perfectly still, a quiet anchor in a storm of panic. Her mind, however, was a maelstrom of its own. She could feel it, an internal echo of the president's struggling heart, a low thrum of misplaced pressure, a subtle resistance where there should be none. The scans had shown a generalized effusion, a common enough problem, but her hands, her unique, intuitive touch, registered a singularity, a tiny, almost imperceptible node of dense, fibrous material clinging to a specific vessel wall, a blind spot the broad-spectrum imaging simply couldn't resolve, obscured by the sheer volume of surrounding fluid. It wasn't just a clot, it was the clot, a stubborn, invisible anchor holding the president hostage. Her heart pounded against her ribs, a frantic counterpoint to the flatlining monitors. Every instinct screamed at her to speak, to share the impossible knowledge that burned in her gut. She saw the president's life force flickering, a dying ember. Her humble nature, her inherent deference to authority, warred with a primal, fierce urgency. The faces of the indigenous elders from her past, their silent trust in her tactile judgment, flashed before her eyes. They had taught her to listen to the body's language when technology failed. And now, Grandview's gleaming machines were failing spectacularly. She took a small, almost imperceptible step forward. Her hand, trembling, half rose, then fell. Who was she, the rookie, the overlooked, to challenge these titans of medicine? Her voice, when it finally emerged, was barely a whisper against the alarms. "Dr. Kholodov," she began, her throat dry, "the scans, they might be missing a specific point of adhesion. A different angle for the guide wire, a slightly deeper, more medial approach." Her words, soft as they were, cut through Kholodov's desperate monologue like a single, discordant note. He spun around, his eyes blazing, not with understanding, but with pure, unadulterated fury. The audacity. The insolence. A rookie nurse, questioning him? The head cardiothoracic surgeon? The president's life hung by a thread, and she dared to interrupt with unproven, nonsensical intuition. The rage that simmered beneath his panic boiled over. "Get her out." Kholodov's voice, a thunderclap of fury, echoed through the sterile theater, his gaze searing with contempt. "A different angle? Deeper? Are you insane, nurse?" He took a threatening step towards her, his face contorted. Dr. Kyriakos, rigid with shock, remained frozen, torn between protocol and the sheer, raw terror radiating from the monitors. The president's life hung by a thread, his fading heartbeat a desperate drum against the silence. Yara, despite the tremor in her hands, found a newfound resolve. This wasn't about her pride, it was about a life. "He's dying, doctor," she repeated, her voice clearer now, stronger. This might work. This moment for Yara, battling dismissal despite her unique insight, resonates with so many of us who felt overlooked. If you love stories where the underdog triumphs and quiet wisdom prevails, you're in the right place. We're building a global community of story lovers just like you. Join us. Hit that subscribe button, become part of our growing family, and help us continue bringing you more thrilling, impactful narratives that celebrate the power of the human spirit. Your support makes a real difference, allowing us to create even better stories for our community. Don't miss out on what comes next. Be part of our journey. Get her out. Dr. Kholodov's roar ripped through the sterile air, echoing with the raw, untamed fury of a cornered beast. His face, usually a mask of professional calm, was contorted, veins throbbing in his temples. He lunged towards Yara, an intimidating figure of incandescent rage, but Dr. Kyriakos, moving with uncharacteristic speed, gently but firmly intercepted him. The other nurses recoiled, eyes wide with a mixture of fear and pity for the rookie. Yara froze, the blood draining from her face, her carefully constructed composure threatening to shatter. Her suggestion, born of desperate intuition, had only intensified the chaos. "Dr. Kholodov, please," Kyriakos urged, his voice strained but steady. "Focus." But Kholodov was beyond reason. Focus? On this insubordination? Get her out before she contaminates my theater with her amateur delusions. His eyes, wild and accusatory, pinned Yara. "You are dismissed, nurse. Get out." Yara's heart hammered against her ribs, a frantic drumbeat of terror and humiliation. Every instinct screamed at her to obey, to retreat into the shadows she was so accustomed to. This was Grandview Memorial, not a remote, forgiving clinic. Here, protocol was law, and deviation was career suicide. But then her gaze fell back to President Ndlovu, his chest barely moving, his skin taking on an ominous pallor. The monitor beside his head, a relentless harbinger of despair, began to scream. A rapid series of piercing, high-pitched beeps tore through the air, faster and faster, each one a hammer blow against the dwindling hope in the room. Then, with a final, desolate wail, it flatlined. A long, unbroken tone replaced the frantic beeps, a sound so stark, so utterly final, it seemed to suck all the oxygen from the room. The chaotic clamor of the surgical theater, the frantic whispers, the sharp orders, all of it ceased, replaced by a deafening, terrifying silence. It was the sound of death claiming its victory. Kholodov, who had been mid-rant, staggered back as if struck. His face, once livid with fury, drained of all color, leaving him pale and utterly shattered. The scalpel clattered from his suddenly nerveless fingers, the metallic ring a sharp counterpoint to the electronic dirge. He stared at the monitor, his chest heaving, his powerful frame suddenly looking fragile, diminished. The titan of cardiothoracic surgery, the man who had faced death countless times with unwavering confidence, was utterly, profoundly broken. Kyriakos, his own face etched with grief and defeat, moved to Kholodov's side. He placed a hand on his shoulder, his voice a low, heavy whisper that cut through the silence like a dull blade. "Anatoly," he murmured, his gaze fixed on the flat line, "we're out of options. There's nothing left to try." The words hung in the air, a declaration of ultimate failure. Kholodov didn't respond, didn't move. He stood there, a statue of despair, his arrogance and bravado utterly stripped away by the cold, hard reality of the president's demise. The immense pressure of the moment, the weight of a nation watching, the crushing defeat of his own skill, it had all culminated in this unbearable, silent testament to his helplessness. In that suffocating void, Yara felt a strange, terrifying calm descend upon her. The fear was still an icy knot in her stomach, but it was now overshadowed by something fiercer, something that burned with a quiet, unyielding heat, a primal, undeniable conviction. She knew what she had seen. She felt the solution. The lives she had saved in the Indigenous clinic, often with nothing but her hands and her intuition, flashed before her eyes. This wasn't about ego or protocol anymore. It was about a life, a human being, teetering on the precipice of oblivion. Her gaze met Kholodov's, and for a fleeting moment, she saw not the arrogant surgeon, but a man drowning in despair. His eyes, devoid of their usual fire, were glazed with a profound, terrifying emptiness. He saw her, then, not as an insolent rookie, but as something. A last, improbable straw in an ocean of loss. It was a fraction of a second, an eternity. Kholodov, unable to speak, unable to form a coherent thought, simply raised a trembling hand. His gesture was not an invitation, not a plea, but a raw, guttural act of utter surrender. It was a desperate, almost contemptuous flick of his wrist, a barely perceptible nod of his head, eyes still fixed on the flat line, implicitly saying, "Try. You think you can do something? Then try. We have nothing left to lose." Yara's breath hitched. This was it. The impossible, last-ditch chance. Her entire body screamed in protest, but her feet, moving with a will of their own, propelled her forward. Every step was an act of profound courage, a defiance of her own nature, a direct challenge to the rigid hierarchy of Grandview Memorial. She was walking into the fire, armed only with a whisper of intuition and a desperate, unwavering belief in the unseen. The silence in the room was absolute, every eye now fixed on her, the unassuming rookie nurse, about to attempt the impossible. Yara moved, a ghost in the hallowed space, until she stood directly opposite Dr. Kholodov, her small frame dwarfed by his towering presence and the intimidating array of medical machinery. Her hands, usually steady and efficient, betrayed a subtle tremor as she reached for the sterile gloves offered by a bewildered scrub nurse. Yet, when she looked at the president's pale face, at the monitors that screened his demise, the tremor vanished, replaced by an unsettling, almost serene focus. All her fear, all her humility, receded, replaced by the instinct that had once guided her through the quiet, desperate emergencies of the remote clinic. "Doctor," she said, her voice a reedy whisper that somehow cut through the thick silence, the pericardial drain. "I need you to hold it." Kholodov, still reeling from his capitulation, stared at her as if she'd asked him to dance. His hand, which moments ago had been poised to declare defeat, instinctively reached for the instrument she indicated. He held it, his grip initially slack, then rigid with a mixture of confusion and resentment. His eyes, usually sharp and commanding, flickered between Yara's face and the president's chest, a silent war raging within them. Who is this girl? What does she think she's doing? Okay, now, this isn't about what the scan showed, Yara began, her voice gaining a surprising clarity. It's about feeling it. There's a pocket, a blind spot, just here. Her gloved finger, slender and delicate, hovered over a point on President Ndlovu's chest that no imaging had highlighted, a place where the logic of Grandview Memorial had drawn a blank. The clot isn't blocking the drainage tube, Doctor. It's blocking the pathway to the fluid. It's a subtle shift, an anomaly in the tissue itself, probably formed rapidly by the trauma. We need to bypass it, not just clear the tube. Kholodov's eyebrows furrowed, a storm gathering on his face. Bypass? What nonsense are you spouting? There's no pathway, nurse, only the pericardial sac and the effusion within it. His voice was a low growl, laced with the last vestiges of his broken authority. With respect, Doctor, there is. A microscopic one, for them. We need to coax it open. Yara ignored the growl, her gaze unwavering. I need you to move the tip of the catheter, very gently, 3 millimeters superior, and then, a quarter turn clockwise. No, not that much. Feel for the resistance. Don't force it. It's like finding a seam in cloth, not breaking a wall. Her instructions were maddeningly vague to Kholodov, who was used to precise, anatomical commands, to lines on a screen. Yet, the image of the flatlining monitor, the weight of the president's life, hung too heavy for him to defy her. His hand, still holding the drain, moved with excruciating slowness, his every muscle screaming in protest against yielding control to this unassuming rookie. Dr. Kyriakos, initially skeptical, leaned forward, his eyes darting from Yara's intense focus to Kholodov's rigid posture, a silent prayer forming on his lips. The operating room, usually a symphony of beeps and hushed medical jargon, was now dominated by the rasp of Kholodov's labored breathing and the terrifyingly slow tick of the clock. Yes, there, Yara murmured, her voice barely audible. Do you feel it? A slight give. Not a hard stop. Just a redirection. Kholodov gritted his teeth, sweat beading on his brow. He felt nothing but the usual resistance of tissue. He wanted to shout, to throw the instrument down, to declare her a charlatan. But then, a faint, almost imperceptible shift. A whisper of movement beneath his fingertips that defied logic, defied his years of training. He did feel something. A tremor of surprise ran through him, quickly followed by a terrifying surge of a feeling he hadn't experienced in decades, uncertainty. Now, maintain that pressure, Dr. Kholodov, Yara continued, her voice steady as a surgeon's own, and angle it, just a hair's breadth to the left. Just ease into it. Don't push. Let the body guide you. It wants to open, it just needs the right invitation. The scene was surreal. The renowned Kholodov, the master of precision, was now a puppet, his hands guided by the soft, almost mystical directives of a rookie nurse. Each millimeter of movement was an eternity, each instruction a challenge to everything he believed in. The tension in the room was a living, breathing entity, coiling tighter and tighter, holding everyone captive in a shared, agonizing breath. A scrub nurse dropped a sterile sponge, the sound echoing like a gunshot in the profound silence, but no one moved, no one reacted. All eyes were fixed on the impossible ballet unfolding at the president's side, a dance between conventional medicine and an intuitive art form, teetering on the precipice of life and death. Kholodov's face was a mask of disbelief, awe, and desperate hope, his knuckles white as he followed the unseen pathway Yara described, pushing against every instinct, every ounce of his training. The quiet intensity in the operating theater had grown so profound, it felt as though the very air had ceased to circulate. Every soul present was holding their breath, every muscle tensed, as Dr. Kholodov, stripped of his usual bluster, moved his hands with an almost unbearable slowness, driven solely by the hushed commands of the rookie nurse. Yara's voice, though soft, cut through the suffocating silence with absolute clarity, a lifeline in the deepening abyss of despair. A little to the left, Doctor. Just a hair. Feel for it, it's like a whisper against the wall of the vessel, yes, there. Now, gentle pressure. Steady, steady. Kholodov, his brow furrowed with a mixture of desperate concentration and utter bewilderment, felt a minuscule resistance. It wasn't the solid, immovable obstruction he expected, nor the clear pathway he'd been trained to find. It was a yielding, yet persistent, presence. He pushed, the syringe barely inching forward, his own heart hammering against his ribs in an echo of the failing one on the table. He felt a shift, a release, almost imperceptible. Then, a sound. It was a sudden, visceral gush. A dark, viscous torrent of trapped blood and fluid erupted into the syringe, filling it with astonishing speed. It wasn't a trickle, it was a deluge, a dam breaking, a violent expurgation of the deadly pressure that had been slowly crushing President Ndlovu's heart. The monitors, which had been flatlining, a relentless, terrifying beep-beep-beep of impending doom, suddenly lurched into life. A steady, rhythmic thump-thump-thump echoed through the room, the sound of a heart, once faltering, now beating with renewed vigor. The line on the ECG monitor, moments ago a flat, lifeless plane, now pulsed with a strong, undeniable rhythm. The collective gasp that tore through the operating theater was a physical entity, a wave of pure, unadulterated shock and relief that slammed into every person present. Nurses slumped against walls, their hands flying to their mouths to stifle cries of disbelief. Dr. Kyriakos, who had been leaning forward, his face etched with grim acceptance, reeled backward, clutching his chest as if he'd been struck. The clipboard he held slipped from his grasp, clattering loudly on the pristine floor, but no one even registered the sound. Kholodov himself stood frozen, the syringe now full, the deadly fluid still draining, his eyes wide, fixed on the monitors, then on his own hand, then on Yara. His arrogance, his fury, his absolute conviction in his own supremacy, all of it shattered into a million pieces. A tremor ran through him, starting in his hands and spreading throughout his body, not of fear, but of an overwhelming, profound awe. The weight of the moment, the sheer impossibility of what had just transpired, hit him like a physical blow. He slowly withdrew the instrument, his movements almost reverential now, revealing a clear, free pathway. The president's vitals continued to stabilize, the steady rhythm on the monitor a symphony of triumph. Yara, for her part, felt the rush of adrenaline finally recede, leaving her limbs weak, her mind buzzing. A wave of exhaustion washed over her, but it was overshadowed by a deep, quiet surge of elation. Her training, her intuition, her once dismissed feeling, had worked. She watched the monitors, tears pricking at her eyes, not of sadness, but of an almost unbearable, profound relief. The president was alive. Dr. Kholodov finally turned, his gaze meeting Yara's. His face, usually a mask of imperious confidence, was now vulnerable, raw. He opened his mouth, but no words came, only a ragged breath. He looked at her, truly saw her, perhaps for the first time, not as a rookie, not as an insubordinate nurse, but as the extraordinary force that had just snatched a life from the jaws of death. There was no anger, no dismissal, only a dawning, shattering respect. He swallowed hard, then with a slow, deliberate movement, offered a silent, deferential nod, a gesture that spoke volumes more than any spoken praise could. It was an acknowledgement of a mastery he hadn't known existed, a humility he had never thought himself capable of. Kyriakos, finding his voice amidst the stunned silence, stammered, How did you, what was that? His scientific mind was reeling, struggling to reconcile the impossible with the undeniable. He looked from the stabilized president to Yara, then to Kholodov, a bewildered, almost childlike wonder in his eyes. The air in the room, once thick with panic and despair, now hummed with a fragile, exhilarating hope. The weight had lifted, replaced by a collective, almost dizzying lightness. President Ndlovu was out of immediate danger, pulled back from the brink by a quiet, overlooked strength. The triumph was palpable, a cathartic release of tension that left everyone shaky, exhilarated, and forever changed. The gleaming, elite walls of Grandview Memorial had just witnessed a miracle, guided by the most unexpected of hands. The air in the operating theater, once thick with panic and despair, now vibrated with a fragile, almost disbelieving silence. The rhythmic beep-beep-beep of President Ndlovu's heart monitor, steady and strong, was the only sound that truly mattered, a pulsating testament to the impossible. The collective exhalation that followed was a physical entity, a wave of relief so potent it left everyone weak in the knees. Dr. Anatoly Kholodov stood utterly motionless, his gaze fixed on Yara, then back to the monitor, as if needing repeated confirmation that this wasn't an elaborate hallucination. His custom-tailored scrubs felt suddenly loose, his starched collar suffocating. The colossal edifice of his ego, so meticulously built over decades of unparalleled surgical triumphs, had not merely cracked, it had crumbled, scattering into 1,000 insignificant pieces at the feet of a rookie nurse. He felt a profound, unnerving emptiness where his swagger used to reside, replaced by a dawning, uncomfortable reverence. He tried to speak, but his throat was dry, raspy. The words "thank you" felt alien, impossible, yet an unfamiliar urge to utter them twisted in his gut. Instead, he simply met Yara's eyes across the sterile expanse, and offered a slow, deliberate nod, a gesture devoid of his usual arrogance, steeped instead in a raw, undeniable respect. It was more profound, more crushing, than any shouted praise could have been. It was Kholodov, the Titan, acknowledging a force he couldn't comprehend yet utterly depended on. Dr. Aris Kyriakos, ever the academic, struggled to reconcile what he'd witnessed with the known laws of medicine. His mind, a fortress of empirical data, had been breached by an impossible truth. He replayed Yara's precise, almost whispered instructions, the elegant simplicity that had somehow bypassed their cutting-edge technology, their advanced diagnostics. How did you, what was that? His voice was a hushed whisper, a scientific mind grappling with something beyond its current understanding. He looked from the stabilized president to Yara, then back to Kholodov, a bewildered, almost childlike wonder in his eyes. Around them, the surgical team was stirring, whispers beginning to ripple through the room. Nurses and junior doctors, who moments ago had been on the verge of breakdown, now stared at Yara with a mixture of awe and profound curiosity. They had seen Kholodov's unassailable authority shattered, replaced by something akin to humility. They had seen a quiet, underestimated nurse step into the void and pull their president back from the precipice. The hierarchy of Grandview Memorial, so rigid and sacrosanct, had just been bent, perhaps even broken. Yara, meanwhile, felt a different kind of tremor. The intense adrenaline that had surged through her veins was now receding, leaving her weak-kneed and profoundly exhausted. Her heart still thrummed, not with pride, but with the fading echo of the president's restored rhythm. She took a deep, shaky breath, her hands, still encased in gloves, trembling slightly. Her first, most powerful instinct was to retreat, to melt into the background, to let the storm of attention pass her by. This wasn't a performance for her, it was a desperate act of care, a calling. Kyriakos, perhaps sensing her discomfort, gently approached. "Nurse Solís," he began, his tone uncharacteristically soft, what was your prior experience? Your file just mentions Indigenous Community Clinic, remote northern region. He was trying to understand, to quantify the unquantifiable. Yara hesitated, her gaze dropping to her still-gloved hands. "There wasn't much technology, Dr. Kyriakos," she said, her voice quiet, almost shy. "No advanced imaging, no complex labs. We learned to listen, to feel, to understand the body not just from scans, but from the inside out. Every tremor, every subtle shift in pressure, every faint murmur, you learn to see what's invisible to machines, because that's all you have." Her eyes, though still humble, held a deep, ancient wisdom. "My grandmother was a healer in the community. She taught me to feel the life in things, to understand the flow." It wasn't a boast, but a simple, factual explanation, delivered with the same quiet dignity that had marked her intervention. It spoke not of certifications or prestigious degrees, but of a different kind of education, one steeped in necessity, intuition, and a profound, empathetic connection to human suffering. It was an education born of direct observation and a desperate need to help, where the absence of technology forced a deeper, more holistic understanding of the patient. This wasn't just a skill she'd acquired, it was who she was, forged in a place where care was a direct communion between healer and patient, stripped of all artifice. Her humility wasn't a performance, it was ingrained, a natural consequence of her path. The revelation hung in the air, a stark contrast to Grandview's gleaming, high-tech reality. It wasn't just her credentials that were revealed, but the very essence of her being, a quiet dedication, a profound empathy, and an uncanny ability honed by necessity, far from the accolades of elite medicine. The staff exchanged glances, a new understanding dawning in their eyes. The invisible nurse had proven to be the most vital of them all, not because she knew more, but because she knew differently, and had the quiet courage to trust that wisdom. The hospital hierarchy had not merely been altered, it had been profoundly reimagined. President Thabo Ndlovu's recovery was nothing short of miraculous, a testament to medical precision, but also, as he would later insist, to a quiet intervention that defied explanation. Weeks after the crisis, a still recovering president, his formidable presence softened by gratitude, requested a private meeting with Yara. In the hushed privacy of his executive suite, away from the glare of cameras and the clamor of political life, he took her hand, his grip firm. "Nurse Solís," he began, his voice resonant with emotion, "you saw what no one else could. You didn't just save my life, you reminded me what courage truly looks like." His words, devoid of pomp, validated her in a way no medical award ever could, affirming the profound human connection that had driven her actions. Dr. Anatoly Kholodov, the once imperious head cardiothoracic surgeon, was a profoundly changed man. The experience had cracked open his rigid worldview, revealing not weakness, but a newfound, quiet strength. His arrogance had dissolved, replaced by a deep respect that bordered on reverence for Yara's unique gift. He didn't just offer her a permanent place on his elite team, he actively championed her, using his formidable influence to advocate for the integration of her intuitive insights into complex cases. In rounds, he would often defer to her, not as a subordinate, but as a peer, asking, "Yara, what do you see?" His transformation was a powerful testament to humility, proving that even the most hardened leaders could evolve. Yara, ever grounded, considered Kholodov's offer carefully. The allure of the elite surgical team was undeniable, a path to grander challenges and greater impact. Yet, her heart pulled her towards a different kind of integration. She accepted, but on her own terms, envisioning a role that blended her tactile diagnostic skills with Grandview's advanced technology. She proposed a specialized mentorship program for junior staff, focusing on holistic patient assessment and fostering an environment where unconventional observations were not just tolerated, but actively encouraged. It was a subtle shift from being one of them to becoming a bridge, ensuring her wisdom didn't just save lives, but transformed how medicine was practiced. Dr. Aris Kyriakos, the chief of medicine, intellectual and protocol-bound, spearheaded the systemic changes. Inspired by Yara's breakthrough, and Kyriakos' own reflection on the dangers of rigid adherence, he launched a groundbreaking initiative, the Diverse Perspectives Protocol. This mandated regular, multidisciplinary forums where junior staff, nurses, and even orderlies were given dedicated time to voice observations without fear of reprisal. Grandview Memorial, once a bastion of strict hierarchy, began to cultivate a culture of open dialogue, valuing the quiet, peripheral insights as much as the prominent pronouncements of its top surgeons. It was a seismic shift, injecting empathy and collaborative spirit into the institution's very DNA. The ripple effect permeated Grandview Memorial. The incident became a whispered legend, a potent reminder that wisdom could emerge from unexpected places. Other nurses, once hesitant, found their voices. Young doctors began looking beyond scan results, connecting with patients on a deeper level. The sterile, high-stakes environment started to breathe, infused with a new sense of purpose and humanity. Yara, still modest in demeanor, moved through the gleaming halls no longer invisible. Her quiet courage had not just saved a president, it had ignited a revolution of thought, proving that true progress often comes not from louder voices, but from listening more intently to the ones previously overlooked. Yara's purpose, once a quiet, internal compass, now shone as a beacon for Grandview and beyond. She continued to mentor, not just in medical techniques, but in the art of listening, of feeling, of connecting. Her journey became a living testament to the power of diverse perspectives, the strength in humility, and the profound impact one quiet voice can have when it chooses to rise. Grandview Memorial, under the silent tutelage of a rookie nurse from an Indigenous clinic, had learned that the most vital knowledge wasn't always found in grand pronouncements or cutting-edge technology, but in the subtle nuances of human connection and the unwavering courage to trust one's own, authentic wisdom. Yara's journey reminds us that the most profound wisdom often lies in the quietest corners, and that true courage isn't always loud. Her story inspires us to trust our intuition and value every voice. What hidden wisdom do you believe is often overlooked in our own lives or communities? We'd love to hear your thoughts in the comments below. If you were moved by Yara's incredible tale and the power of overlooked heroes, please subscribe to join our global community. Your support truly helps us create more compelling, heartwarming stories like this one. Thank you so warmly for watching, for sharing this journey with us, and for being such a valued part of our growing community. Together, let's keep celebrating these impactful narratives.